It's been 6 years since the Brexit referendum. So, what's the actual impact been on the NHS? If you forget the politics for a second, what does the evidence say? Well, a major report from the Nuffield Trust has done just that. They've audited the evidence, and today we're going to break down what they found, from the NHS workforce to the supply of our medicines.
So, this is the big question, right? It's the one the report really digs into. And this isn't about refighting old battles. It's about looking at 6 years of data to understand the real world consequences for our health service. Okay, so here's the plan. We'll start with the big picture audit. Then we'll dive into how the NHS workforce has changed, look at the friction in our medicine supply chains, connect the dots between the economy and our health, and finally, wrap up with what this all means for the resilience of the whole system. All right, first up, let's just zoom out and look at the big picture. What did the Nuffield Trust actually find when they compiled all the evidence to get an impartial view of what's changed since 2016? Well, right off the bat, the conclusion is pretty stark. The report argues that Brexit was, in their words, another blow to a system that was already stretched to its absolute limit. You have to remember this didn't happen in a vacuum. It hit an NHS that was already struggling with years of budget pressures and staff shortages, and that was all before the pandemic. So Brexit essentially became one more major stressor on a system that was already cracking.
So let's dive into our first big topic, the NHS workforce. The story here is way more complex than you might think. It's not just a simple case of losing EU staff. It's about a massive, fundamental shift in where the NHS is now getting its people from.
And what the report found are these two huge competing trends. On the one hand, since the referendum, there's been a really significant drop in the number of nurses coming from the EU. But on the other hand, there has been an absolutely massive surge in recruitment from the rest of the world.
And I mean, the scale of this change is just staggering. Look at this. The number of nurses coming from outside the EU has absolutely skyrocketed, from about 800 a decade ago to 18,000 in just 1 year. So if you're just looking at the raw numbers, this has more than made up for the fall in EU nurses.
So you look at those numbers and you think, great, problem solved, right? Well, according to the Nuffield Trust, not so fast. It turns out these big headline numbers are actually hiding some really serious gaps that are still there. See, this big pivot to global recruitment, well, it hasn't worked for everyone. The number of EU dentists registering, for example, has been cut in half, and there's been no replacement from anywhere else. Social care is still struggling to make up for the EU staff it lost, and maybe most critically, some really specialized fields like anesthetics, which used to rely heavily on EU talent, have seen recruitment just plummet. Now, this massive boom in global recruitment brings up a really thorny ethical question, and it all revolves around this idea of red list countries. Basically, these are nations that the World Health Organization says have their own critical shortages of health workers, and official UK policy says the NHS should not be actively recruiting from them. And yet, here's what the report found. Registrations of nurses from these red list countries have surged, from around 600 a month before the pandemic to almost 1,000 a month in 2021. The report really questions whether this is all just passive recruitment, raising some pretty profound ethical issues about whether we're draining talent from health systems that need it the most. Okay, next up, let's talk about getting medicines into the country. Before Brexit, the big fear was a cliff-edge catastrophe, right? Vital drugs getting stuck at the border. Well, that didn't happen. But what the report finds instead is something a bit more subtle, a new reality of constant friction, extra costs, and nagging shortages. This quote from the report sums it up perfectly. The absolute worst-case scenario was avoided, but that was thanks to huge government preparations, stockpiling medicines, creating new freight routes, the whole shebang. But the underlying problems didn't just disappear. They're just popping up in different, more unpredictable ways now. This chart is a great way to see what the report means by uneven problems. It shows something called price concessions. That's basically when the government has to give pharmacists permission to pay more for a drug because they just can't find it at the normal price. Before 2016, this was pretty rare, maybe 20 a month. But since then, it has spiked again and again, hitting record highs and signaling that the supply chain is under constant pressure. So maybe the best way to think about this isn't like a giant wall at the border stopping everything. It's more like a whole series of new hurdles that have been put in the way. You've got extra paperwork, new regulatory checks, driver shortages. Each one of those little hurdles adds a bit of time and a bit of cost, and it just makes the whole system slower, more expensive, and a lot more fragile.
And you can actually see the effect of all this on a global scale. It's kind of wild. While medicine imports have been going up steadily in every single other G7 country, the UK's have uniquely fallen back to where they were a decade ago. The report links this to things like the weaker pound and new trade barriers, which just make it harder for the NHS to compete for medicines on the world market.
Okay, so beyond these direct impacts on staff and medicine, the report also zooms out to look at the wider economy. And this is so important because it connects the economic consequences of Brexit directly to the health of the whole country. The report basically lays out this really clear three-step chain of events. First, research shows Brexit has slowed down the UK's GDP, trade, and investment. Second, that economic drag leads to lower real incomes, putting a squeeze on household budgets. And third, we know for a fact that there's a strong link between poverty and poor health, which, of course, creates more demand for the NHS down the line. So what it all boils down to is this. The report concludes that by slowing down economic growth, Brexit is likely worsening the squeeze on household incomes. And when that happens during a massive cost of living crisis, it's an added pressure that's inevitably going to have knock-on effects for public health. So what does this all add up to? Let's pull all these different threads together for the final takeaway after looking at 6 years of data. The whole analysis really boils down to 3 key things. On the workforce, the UK basically swapped its reliance on the EU for a reliance on the rest of the world. But that's created new ethical problems and left gaps in key specialisms. For medicines, we avoided the cliff edge, but now we live with a slow burn of constant friction and extra costs. And on the economy, Brexit has likely been a drag on our incomes, which is directly linked to poorer health outcomes. And that leaves us with this final, really tough question. The theme that keeps coming up again and again is that Brexit has been an extra burden placed on a system that was already at its breaking point. The challenge for the future isn't just about Brexit anymore. It's about how a health service that's under this much compounding pressure can possibly continue to cope.